Traditionally, NIH has been involved in doing the basic science discoveries that ultimately are picked up by a company, and then they do the development of that new diagnostic or that new therapeutic. Although, let's be fair, NIH has been a player in this area in certain fields like cancer, for instance, or infectious disease for a long time. But the time is right to expand that. Clearly, the opportunities have grown. We have more new targets for drug development than ever. And the companies are struggling a bit because of the economy. So NIH could now step up and play a larger role by looking at those new targets, starting down the path towards developing those into something that would be clinically beneficial, de-risking the project to the point where it looks like it's economically viable, and then handing it off to a partner company to carry it all the way through to FDA approval and ultimate public benefit. It's a different sort of model. I mean, it's going to require a lot of close coordination, but it's a win-win for both the NIH and for the companies and for the public, a triple win. I think a lot of people think of NIH as the place where they do good medical research and maybe it helps people in terms of human health, but I don't know that they appreciate the way in which it also drives the economy. Every dollar that NIH gives out in a grant, and most of our money goes out in grants across the country, returns $2.21 in 1 year in goods and services to the local community. There are very few economic investments that have that kind of turnaround that quickly. We support 50,000 grants roughly. That's about 350,000 jobs. And these are good jobs with lots of potential. And to be able to continue that engine right now seems to make a lot of sense, especially if we have new opportunities for partnerships where what we're doing is also stimulating the private sector, allowing companies that were not quite sure they were going to make it to get along because we step in and help them as we are already starting to do. Allowing pharmaceutical companies to have new targets that they didn't know about in order to speed up their process of success. And it helps, of course, on the global stage, America to continue to be a real competitor. We've been slipping a bit, to be honest. And other countries like China and India are coming up very fast. That's good for them. But we ought to be sure that we continue our efforts to be the innovators, to be the people with the bright new ideas, to be the risk takers. NIH is a driver of all those things. Patient advocates are our clients. We really depend on hearing from the community about where the needs are the greatest, and we depend on them also to tell us when we're doing a less than adequate job in terms of getting something out there that isn't quite working. All across this spectrum, from basic to applied, we need to be hearing from patient advocates about what they see as the gaps that aren't being filled. But we also need them to be our advocates. The NIH is still not a household word. Many people don't know what it is. Many people who do know what it is don't realize that we are the funder of all the medical research that you hear about going on at Harvard and Stanford and the University of Michigan and all those other places. And to spread that word, and also to make the case that this is our hope for the future, for diseases that we currently don't have good interventions for. That's a message that can't be heard often enough.